Hello, I'm Dr. W. John Martin. This is the second of a series of new videos to remove any doubts about the existence of stealth-adapted viruses. The first video covered the beginning of the research from 1986 through to early 1990. It showed on the basis of positive results using low stringency polymerase chain reactions, 1, that chronic fatigue syndrome patients, as well as some patients with more severe brain damage, were virus infected. 2, that different patients could be infected with different types of viruses. 3, that one type of virus had DNA sequences common with herpes viruses, but also DNA sequences that were common with a retrovirus. 4, when looked for, virus could be detected in the cerebrospinal fluid and even in a brain biopsy. And 5, the viruses failed to evoke inflammation, the hallmark of most infections. This video will address the issue of culturing atypical viruses from patients. It will describe the first 2 patients from which viruses were cultured. Patient number 1. This patient was a 43-year-old woman who worked as an assistant to a physician treating AIDS patients. She was in good health until becoming ill in August of 1990. Her illness began with a sore throat, and a week later she had severe headaches, muscle aches, and fever. She was hospitalized mainly because of the headaches and to exclude or rule out encephalitis or meningitis. The cerebrospinal fluid examination showed no changes. There was no inflammation, no inflammatory cells. She stayed in the hospital for 7 days with some slight improvement, but was discharged without a confirmed diagnosis. She continued to feel ill with overwhelming fatigue and was unable to return to work even on a part-time basis. I was invited to visit with her by her physician. I recall learning from her how she was losing her memory, but it was so obvious. She was using the word this and that to describe common items rather than recalling the appropriate word. She continued to have headaches and was sleeping poorly. I obtained a blood sample for PCR assay and came back to tell her that it was positive using both low stringency PCR assays. I then requested and obtained a sample of blood for cultures. I incubated her lymphocytes with commercially available human foreskin fibroblasts. This is a rather bland cell type on which one can observe induced cellular changes. This is a photo of the elongated, spindle-shaped foreskin fibroblasts. After a delay of several weeks, some of the elongated cells became more rounded and enlarged, and their cytoplasm appeared foamy and vacuolated. The affected cells remained attached, which is unusual for many viral cultures, and the cells formed into tightly adherent clumps in which there was cell fusion known as Syncytia. By 8 weeks, I knew I had a virus cytopathic effect. Now, this is not a photograph of her first initial culture, but it shows the type of changes that I was seeing. This is from a similar positive culture in which the cells are stained, and you can see how the cells have fused together. Now, this type of cytopathic effect is different from that of common clinical viruses. Moreover, the cultures did not stain with typing sera against common viruses. I went back to the patient and obtained some more blood, and this time, in addition to using human foreskin fibroblasts, I incubated her cells with MRC5 human fibroblasts and with rhesus monkey kidney cells. All 3 cell lines gave the same type of cytopathic effect. Indeed, in later studies, I was able to show that her virus could grow on cells of many species. These included mice and rats, cats, hamsters, rabbits, duck, chicken, and even insect cells. Patient number 2. This patient was brought by ambulance into the Los Angeles County Hospital. She had previously been a patient in the county hospital. In May of 1987, when she was 19 years old, her mother had brought her in because of irrational and aggressive behavior. At that time, she was extremely agitated and afraid of losing her mind. She admitted to hearing voices from God and from the devil. She was admitted with a diagnosis of schizophrenia. After several unsuccessful trials of different therapies, she seemed to respond to lithium, and her diagnosis was changed from schizophrenia to bipolar psychosis. From the period of 1987 through to 1990, she had been institutionalized at varying facilities with different levels of confinement, depending upon the severity of her fluctuating illness. In early January of 1991, she became acutely delusional and had visual, auditory, and tactile hallucinations. She was admitted to a psychiatric hospital. 17 days later, while hallucinating, she collapsed and passed into a coma. She was brought then by ambulance to the hospital. During the 30-minute ride, she had 6 generalized seizures. When she arrived in the emergency room, she had a brief cardiac arrest lasting less than 5 minutes, and her pupils remained responsive to light. A CT scan with contrast was normal, a lumbar puncture was made, and cerebrospinal fluid was obtained. It had no cells. Now the patient was put on acyclovir from days 2 to day 13, but stayed in a comatose state, and I'll mention more about this patient later. The cerebrospinal fluid was cultured on human foreskin fibroblasts, on MRC5 human fibroblasts, and on rhesus monkey kidney cells. The cultures were retained beyond the usual 4 weeks of observation. By 6 weeks, they began to show the same cytopathic effect as I had seen earlier. I could distinguish between the 2 cultures, but one could see the same foamy, vacuolated cells. The cultures did not stain with regular typing sera. Again, it was an atypical virus. A sample of this virus was provided to the Los Angeles County Public Health Laboratory. I also called the Centers for Disease Control and Prevention to report the cultures. The response I had was one of skepticism and disinterest once I mentioned that I was working on the chronic fatigue syndrome. I think the general belief was that there must have been a contaminant somehow coming into the laboratory. I then called Dr. Paul Cheney, and he graciously decided to fly across to Los Angeles. This will be the topic of the next video. Thank you very much.